Hello, this is Tony Heller from RealClimateScience.com, setting the record straight about science. Over the past 12 years, I've built up a large following by highlighting the huge disparity between actual climate science and that being touted by the press, politicians, and many academics. Recently, I've focused a lot of my efforts on a new mass media, government, and academia-created panic. 3 months ago, the COVID-19 virus started causing a lot of problems in Italy. The government of Italy foolishly responded by sending sick people into nursing homes full of very old people. This forced tens of thousands of people into intensive care, which overloaded the hospitals and the morgues. COVID-19 patients in Italy's virus epicenter of Lombardy were transferred to nursing homes by an official resolution with catastrophic consequences. Over 2 months ago, the Italian government reported that the average age of death in Italy was 80 years old and that 99% of those who died had other serious illnesses. This report made it very clear who was at high risk from this virus. Almost all of the people who were dying from this virus were very old and/or they were very sick already. Many of them would have died this year with or without the virus. There was never any reason to believe that this virus was a huge threat to young, healthy, working-age people. But videos started appearing online of mayors of Italy begging other countries to go into lockdown. What these mayors should have been saying is that other countries need to protect their elderly in their senior care centers from insane government policies. Across Europe, half of the COVID-19 deaths occurred in nursing homes. Europe's handling of nursing homes was a complete disaster and led to tens of thousands of deaths. 2 months ago, some of the worst academic computer models ever written started predicting millions of deaths in the United States and the United Kingdom. These models had no factual basis, and they were so badly written that the authors refused to release their code. And based on these worthless computer models, the press and government started touting the idea of flattening the coronavirus curve. The idea was that most people were sooner or later going to get exposed to coronavirus, but by locking down the entire population, government thought they could slow down the spread of the virus and prevent the hospitals from getting overloaded. But the reality is that outside of a few locations like New York City, there never was a major surge. This graph shows hospital and emergency room occupancy at one of the largest hospitals in Arizona. As you can see, around the time of the shutdowns, hospital activity plummeted. There never was a surge. And I've heard exactly the same story from hospital workers in many parts of the country. The surge never occurred, hospital activity has been very low, and hospital staff has been getting furloughed. One of the few places in the United States where hospitals did get overloaded was New York City. About half of all U.S. COVID deaths occurred in New York City, despite the fact that New York City comprises less than 3% of the U.S. population. The New York City death rate is the highest in the world and is wildly disproportionate compared to the rest of the United States. One of the reasons that New York City was so hard hit was because on March 25th, Governor Cuomo issued an order requiring New York nursing homes to take in sick COVID-19 patients. Governor Cuomo did this despite the overwhelming evidence from Europe that this was exactly the wrong thing to do. He made exactly the same mistake which Italy did and warned other countries not to do. Governor Cuomo wasn't the only governor who did it. Democratic governors in other states did exactly the same thing. And at the same time Governor Cuomo was inflicting this disaster on the nursing homes, he banned entry by families of the residents to the homes. This made it impossible for families to protect their loved ones from the government insanity being inflicted by the state. Not surprisingly, coronavirus spread all over blue state nursing homes and killed tens of thousands of elderly people. My 100-year-old grandmother is in a nursing home in New Jersey. More than half of New Jersey deaths have been in nursing homes, and families are not allowed to go in to see what's going on or to protect them. And now the state of New York has deleted that executive order from their website, and Governor Cuomo claims that he didn't know anything about it. Perhaps nobody told him that he is the executive who creates executive orders. Another hard-hit state is Michigan, where Governor Whitmer has been doing exactly the same thing, endangering nursing homes by sending sick patients into the homes. And in another blue state, Massachusetts, families of residents of nursing homes describe what's going on there as a nightmare within a nightmare. There's a consistent pattern of reckless behavior by blue state governors. More people have died of coronavirus in New York and New Jersey nursing homes than all the deaths combined in the states of Florida, Texas, Georgia, and Ohio. We have a blue state problem which has been caused by reckless behavior from blue state governors. Senator Rand Paul, who's also a doctor, has pointed out that the mortality rate for coronavirus approximates the annual flu for people under 60. This makes it clear that there's no basis for the working age population to be locked down. We don't lock down our working age population and our school population over the flu epidemic which occurs every single year. The problem the United States has been primarily with elderly people in nursing homes, and this is largely due to extremely bad practices coming from blue state governors. These blue state governors like Cuomo and Whitmer are doing exactly the opposite of what the science says they should do. It's difficult to understand why they did this and why the CDC did not tell them to stop. It should have been obvious to everybody involved that sending sick people to nursing homes was going to kill a lot of people. And at the same time, there is no scientific justification for keeping healthy, working-age people from making a living and feeding their families. There shouldn't be any lockdowns occurring, but the lockdowns have forced 40 million people out of work, and many more will be forced out over the next few months. This is breaking up countless families, leading to huge amounts of suicide, poverty, hunger, and eventually will lead to massive amounts of homelessness. The huge surge in poverty and homelessness is also going to lead to massive problems for the healthcare system. If we really wanted to flatten the curve, we should have removed Governor Cuomo from office several months ago. There was never any significant curve to flatten in most locations, but blue state governors have now done a bait and switch. Now these governors are forcing people not to work for absolutely no rational reason. It no longer has anything to do with flattening the curve. This New Jersey woman who was just trying to feed her kids had her Facebook Live sale shut down by the police. Other people were spying on her on Facebook and reported her to the police. The police showed up, shut her down for trying to make a living, and cited her for not wearing a face mask in her own empty business location. I married a Soviet refugee, and this is exactly the kind of neighbor upon neighbor spying which went on in the Soviet Union. Her brother was arrested after a neighbor reported him for selling a pair of blue jeans. And here we are, 30 years after the fall of the Soviet Union, doing exactly the same thing in the United States of America. And back in my former home of Boulder County, Colorado, you can now get a year in jail for going outside without a face mask. There is no evidence that face masks are effective against coronavirus. The droplet size which coronavirus attaches to is too small for the pores in the face mask. It's like trying to stop a mosquito with a chain-link fence. The Center for Infectious Disease Research and Policy at the University of Minnesota says there is no scientific evidence that masks are effective in reducing the risk of SARS-CoV-2 transmission. And masks have an additional problem in that they collect virus on the outside of the mask. Then people keep touching them, and then they go and they touch the produce, spreading virus all over food, which other people are going to consume. Policies being performed in much of the United States are not based on science, and in some blue states, what the governors are doing is the exact opposite of what science would tell them to do. The wearing of masks makes everybody suspicious of everybody else. Every other person becomes a threat who could potentially lead you to a horrible death alone in a hospital bed. There's no smiling when people are wearing masks and no chance of society returning to normalcy. Even Dr. Fauci said that people should not be going around wearing masks.
Right now in the United States, people should not be walking around with masks.
You're sure of it? Because people are listening really closely to this.
Right now, people should not be walking. There's no reason to be walking around with a mask. When you're in the middle of an outbreak, wearing a mask might make people feel a little bit better, and it might even block a droplet, but it's not providing the perfect protection that people think that it is. And often, there are unintended consequences. People keep fiddling with the mask and they keep touching their face.
And can you get some schmutz sort of staying inside there?
Of course. But when you think masks, you should think of healthcare providers needing them and people who are ill.
There's no reason for young, healthy people to be going around wearing masks. Older people who believe they're at risk have justification for wearing a mask, but not young, healthy people. And it's absurd for places like Boulder County to be requiring young people to be wearing masks. Through all of this, the press has been worthless at best, and more often they've been extremely destructive. The tens of thousands dead in blue state nursing homes should be the biggest story of the year for the press. But the press is in bed with the perpetrators of the problem, and they're not only not helping, but they're actually making matters much worse. The press coverage from CNN and many other networks has been a complete disaster. What we should be seeing is stories like this from Front Page Magazine. We desperately need accountability for the behavior of these blue state governors. Instead of legitimate journalism, we've been getting a steady stream of propaganda from the U.S. press corps. As a result of this propaganda, blue state governors like Governor Cuomo have seen their approval ratings skyrocket, even as they've done everything exactly wrong. This is disturbing enough, but it leads me to a conclusion which is even more frightening. We have tens of millions of people out of work around the country because of these lockdowns, yet governors who are instituting the lockdowns have very high approval ratings. People are so scared that they're willing to throw millions of other people under the bus for the simple crime of breathing. As a Jew, I'm keenly aware of how mass propaganda campaigns were used in Germany during the 1930s to instill fear. During the 1930s, the German public became convinced that the safest strategy for them was to deprive the civil rights of people who were of the Jewish faith. This led to horrific atrocities in Germany. The German public never voted for the atrocities, but through the campaign of propaganda and fear, they allowed themselves to submit to it. And now in the year 2020 in the United States, we're faced with the prospect of millions of homeless children. And governors who are implementing this policy have very high approval ratings. Like with Germany in the 1930s, many Americans have been driven mad with fear. Martin Niemöller spent 7 years in a German concentration camp. He said, "They came for the Jews and I did not speak out because I was not a Jew. Then they came for me and there was no one left to speak for me." We can't allow millions of children to become homeless because of our irrational fears. If we allow people to be victimized for no reason other than the fact that they exhale, nobody will be safe moving forward. We need to protect our elderly from dangerous policies by blue state governors. And at the same time, we need to protect our young people from other dangerous blue state governor policies. If we don't, there's not going to be anyone left to speak for us. This is the front page of tomorrow's New York Times, listing the names of 100,000 people who supposedly died from coronavirus. They don't specify how many thousands of those were due to blue state governors sending sick people to nursing homes. They also don't list the names of the millions of people who've had their lives destroyed by government lockdowns. This front page is about politics, not sympathy. The New York Times is shedding crocodile tears. We had flu epidemics in 1957 and 1969, which killed well over 100,000 people, and the New York Times barely noticed. In an average year, we lose about 60,000 people to the flu and many more to pneumonia, and the New York Times really doesn't care. The left wants to blame a high death count and a high unemployment rate on President Trump because they have an election coming up in November, and they're still mad about losing the one in 2016. This is not about caring about people. If they cared about people, they would have called out Governor Cuomo for sending sick COVID patients into nursing homes. With the New York Times, everything is about politics. They've been working very hard to try to bring President Trump down for the past 4 years. But I'm concerned that there may be much more to this story. People on the political left have been talking about massively reducing Earth's population for a long time. It would be a really good idea for us to pay close attention to them and realize that they are quite serious about their intentions. It would be very foolish of us to ignore what these people are saying. Many Jews chose to ignore what the German socialists were saying in the 1930s, and they paid very dearly for it later. There are lots of warning signs around us now, and we need to pay close attention. Toto is paying very close attention. That's why he chose to leave the blue state of Colorado and move to the red state of Wyoming. Toto had no intention of being prosecuted for refusing to wear a completely useless item of clothing. Visit him on the web at realclimatescience.com. He's been playing back the curtain on junk science and propaganda for a long time.